Order, and then let's do the pledge. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And I think it's wonderful that people get together and have a few minutes to talk ahead of time.
Yeah.
I always feel that. Well, most people talk ahead of time.
Thought maybe you had a budget.
No, there's no bad.
Oh, yeah.
Except for we gotta start the meeting. Everybody read the minutes?
I make a motion to approve them.
Thank you.
Second?
Second? All in favor?
Over second.
What's that, Frank?
They're fighting over second.
There you go.
Okay. All in favor?
Aye.
Opposed? Motion carried. King Chang, you have one resolution?
Okay, yes, this is one resolution we presented to you is $34,000 for annual incentive competition awards, and the State Health Department runs annual quality improvement competition since 2013, and this is the 9th. In the past 9 years, we got 8 out of 9, and we have one of our strong team here. And this time they focus on preventive, and I think yes, usually we get this money and fill the gap for budget. For example, like expensive medication and like VA equipment like this. And this time, yes, we propose some more money for training and for training and these kind of things. The rest of money will still go back to cover some Article 6 covered items. So this is what we presented here.
We have a motion for discussion.
Make that motion.
Second.
Is there any questions, discussion? All right. All in favor?
Aye.
Opposed? Motion carries. So we're going to change up a little bit on the reporting, because some people have to make movement to some other things. Bill may have to be a little working. So.
Yeah, we propose, yes, if you can change the agenda here, and because here you put you see the first 3 items, actually it's one package. It's all about professional advisory committee. So also, one thing here missing is our environment health department updates, and I hope we can include them. So I hope every meeting introduce you a division, so when budget season coming and you understand what we are doing, why we need the money, and get your support. That's the reason. Propose you change the agenda item a little bit here, if you agree.
That's fine.
That's fine. Okay, so it's your turn.
Oh my. Thank you for letting me be here. I intended to be with you the last meeting, but I had a health incident involving my heart. I'm going to tell that to you now. I normally wouldn't tell, but I get tremors and I have difficulty breathing. So bear with me. And what I want to do is tell you what the Health Department Environmental Division does. So,
Did you want to put this?
yes, please. What?
Yep, you said it.
You might have to point it to the computer behind you.
I'm faster. I calculate here.
Oh, okay.
Yeah.
All right. So people often confuse us with environmental science. Environmental health, specifically environmental public health, focuses on how humans and our health is affected by the environment, contaminants and pollution and hazards. EPA and DEC, on the other hand, focus on how humans adversely affect the environment or pollute the environment. So we're just a little bit different, but we often get confused. Give me a second. I'm sorry. Okay, so most people don't realize how vast our programs are, how many programs we have, and how complex they are. So I thought for this first visit that I would just go through the programs quickly, briefly, not go into great detail so you know everything we do. And then if you would like my experts to come back and talk to you, or more information in written form given to you, or if, better yet, you would like to come visit our department and see what we do, we would welcome that. So we start off with a food protection program, and that's the one that most people know we do. We do risk-based inspections. We're looking for contamination to food that is being sold to the public. So it could be a person contaminating the food, it could be a raw food, like raw chicken contaminating a salad, or it could be the equipment they're not cleaning. They cut up raw food, then they go in and they start cutting up salads and things that are ready to eat. So that's our main focus when we go in, and it deals a lot with temperatures. There's 3 codes that apply to this. Our jurisdiction, our statutory authority, is the New York State Public Health Code, as well as the New York State Sanitary Codes. So there's 14.1, the brick and mortar restaurants, the food trucks, and the concession stands, like at Harbor Fest, the pop-up concessions. The other one that most people know we are involved somewhat in is the water supply protection. This ranges from the big community systems, municipals in the 2 cities we have, as well as the little rural restaurant that just seats 20 people and they're using their well on their property to serve the water to the people. And what we do in all these programs is we give public education, we're investigating, inspecting, and monitoring the environmental contaminants to see if they're present and identified. And then as a last resort, we are an enforcement agency and we will seek enforcement action. But we try to get voluntary compliance, and in most cases we can do that.
Can I ask a question?
Yes,
The oil spill in the lake,
yes,
that's where we get our water from.
yes.
Okay, how is that being monitored?
Okay, it's a body of water that's contaminated. I know it affects the drinking water, so our public health engineer did respond, but the major cleanup operation in all our other agencies, I believe, is DEC.
So somebody is monitoring the water that we're drinking to make sure it's safe, though?
Oh, yes, samples are taken daily throughout the distribution system as well as at the plant itself. So this is, I'll go back. How will I go back to
It's the other side. Yeah,
Previous? Yep. Previous. Okay, so the water supply program that we do is not just massive, but it's complex. And these are all the rules that are located in parts 5.1, which is the water code. There's a code for everything. You'll see the theme going through here. So we have scientists, our technical people, our professionals, they have a science background so they can interpret the elements and compounds that we're looking for and give advice, technical advice on how to filter for things, remove things, and get safe water. Thank you. Okay. This is great. We regulate public water supplies because there's a sanitary code for that. But we are also offering a residential well-assisted program to private property owners who want to know what their well water is as far as bacterial content and elements. If it smells funny, it could be sulfur, but we will take the test for them, give them technical assistance. If it's bacteria, we'll tell them how to disinfect the well. And if it's other chemicals, we can discuss treatment options they might consider putting on their system.
I got a question.
Yeah.
Back 2 slides, you had a number of
This.
categories, yes.
Mm.
What happens with this data? Okay, you have all this data that you collected.
Yep.
Do we have somebody that tracks this and takes a look at it and makes an
Yes.
analysis of this?
Yes, and that's us. We don't just collect samples. We interpret the lab reports, and then we provide the technical assistance to the facility that has these issues. We monitor it, and we have our in-house systems where we have a database that tells us what facility has a MCL, or they're above the maximum contaminant level that's acceptable. And that is tracked by our epidemiologist. We just got an epidemiologist in January. She was an existing member of our staff that qualified for this great position. So what she's doing is she is keeping a running data and notifying our sanitarians and technicians when resampling has to be done, when a bad sample comes. And then on top of everything, my clerical staff entered into the SIDWIS database. It's the New York State Safe Drinking Water Information System. And it's right there. The state can monitor it, we can monitor it. So yes, nothing is lost. We enter results on a daily basis. And anything that any adverse contaminant or exceedance, a letter is sent out and our staff are available to help them figure it out.
All right, now, let's back in this a little bit different. And you gave a good explanation on it. I took geology in college, so I'm familiar with a lot of this stuff.
You want a job?
This county is served by many aquifers,
Yes,
and those aquifers are interconnected.
yes.
And you said they send out letters, you guys send out letters, whatever. Who is the ultimate enforcer of taking care of this and having these entities that you're
That we
testing and getting them off their dead barrier to do something about it?
Okay, if we try to get voluntary compliance, we explain the law, why we're doing it, and sometimes just telling them why they have to do it, they'll go ahead and do it. But if we get non-compliance, we will turn to our county attorney, usually a letter from them saying, hey, you had to put this treatment on, you haven't done it. Kicks them in the bottom and they move ahead, and if they don't, then we go to a hearing with a hearing officer. I don't believe that has ever happened for water treatment. We've done it with septic systems that were down, mobile home parks, and lead cases, which I'll get to later. But it turns to legal when we can't get compliance.
And public health law contains provisions that if there's an order issued, violation of that order can also be a misdemeanor. And it's not just public water. If a restaurant has been cited and has to shut down because of unsafe practices or water or what have you, there's an enforcement provision for other programs as well. Or if they're operating without permit, we continue to tell them they need to get a permit. They don't have one, they can be shut down.
That answers part of it, yeah.
Okay, and we can get into that later, too, if you want to. We've done our private well. Now let's move from drinking water to water we swim in. We regulate beaches, swimming pools, spas, and our new water park that's going to open this fall, hopefully. If you look at the numbers, we have 10 public beaches and we have 28 swimming pools, and you might wonder, where the heck are these 28 swimming pools? Well, they're not just municipal pools. I think we only have one left in the city of Oswego, but it's also pools at hotels, motels, campgrounds, schools, our district schools, as well as SUNY Oswego, we do their pools too. And we're looking for things, the usual. Yeah, water chemistry, is it clean, is it filtered? But our main concentration is supervision. Are the aquatic certifications of their lifeguards up to date and valid? And then it's the safety equipment on deck, at a pool, and at a beach, right at the beachfront, and available for the guards and patrons to be able to use. Yes.
Frank Stelia. I live in the city of Fulton.
Mhm.
And recently there was some comments about the no swimming ban has been pulled from Lake Neonawani. Do you know anything about that? Is that,
No.
that possible, or?
At this point, it's not a permitted beach. To be permitted, engineered plans have to be submitted to our department, and the state also gets involved when it's a public beach. We're looking at the bottom, make sure the bottom's stable and safe, and that if a swimmer goes into it, they're not stirring up all the silt, and we can't see the bottom because then the lifeguard can't do their job. They have to take samples for a period of time throughout the year before they open, especially during a heavy rainfall, and we're looking for E. coli, any septic wash-off that might be present in the lake. We look for turnover. It has to have a good circulation rate, and it's all engineering stuff. And as far as I know, and I can say flatly, we don't have any engineering reports submitted for Fulton. It also is subject to blue-green algae outbreaks. Those are for the closure beach anyway, and that's due to phosphates and nitrates in the water, basically agricultural runoff over the years. So I know they're working towards trying to do that. They're nowhere near it.
I just, so right now it's no.
No.
Thank you.
No. And I know everybody remembers it as a child as being a great place for the family to go.
Yes.
Okay, children's camps is special to me. It was the program assigned to me when I first started. And when we send our children, our grandchildren, our nephews, our nieces to camp, we're thinking somebody is overseeing that children's camp and making sure my child's safe when I'm not there. Well, that agency is environmental health. So we do the usual. Safe water, no tripping hazards, the grounds and buildings are being maintained, the dorms they put them in, or the tents are meeting code requirements, because there's code for each one and there's the code for that one. But we mainly focus on supervision. That's the thing I tell every new sanitarian. When you go to a camp, supervision, supervision, supervision. The people that work there and the people that volunteer there cannot start till they have a background check done, and there's proof of that check, and it's against the New York State sex registry, and that's the main one for everybody. The director goes through a much more detailed background check, which is conducted by the state. And we're also looking for ratios. Each activity, depending on its complexity, has a different counselor to camper ratio. So we do a pre-review of their safety plan where they have everything per code, and then we do the in-season safety inspection where we're making sure they're implementing what they said they're going to do to meet the code requirement. We also investigate illness and injuries at children's camps. We've had allegations of sexual and physical abuse, so we're kind of a all-in-one protecting children at a children's camp. Campgrounds are great because RVing is really popular now, and our county has 57 operations where people can go and enjoy the outdoors while they stay and see the sights here. Our campgrounds range in size from 5, which is the smallest that we regulate, all the way up to 1,377 campsites at Friends Beach. I know the number because I inspected them for 16 years. It's quite an operation up there. And remember, we're not just looking at the campground, we're looking at the food, the pools, the beaches, whatever is located up there, the water. Other guests coming to our county don't want to stay in a campground, so we have options that are hotels and motels. We're looking for general sanitation and that they have an emergency procedure in place so that in the case of a fire, they know when to, what escape to take, where to assemble. And I told you this was going to be fast and dirty, and I know it is. I know we spoke before the meeting that this is hard, but it's an introduction so that you can ask us for more.
Did you have a question?
So we have 11, yes?
I have a quick question on the last slide. You said 11 or more people. Now, if you've got a house that they do Airbnb and it's 11 or more that they put out there that they can house, do you inspect those?
We aren't really aware of a lot of the Airbnbs, and I'm not sure how that works.
Okay.
But no, I'm not aware of any that we regulate. We have 11 migrant farm worker housing units here in our county because we're a wonderful rural community. We work very closely. Let me take a drink of water. With the Department of Labor. They send us a list of H-2A workers from outside the country, how many and what farm is their destination where they'll be working. That triggers my sanitarians to go out to that farm, make sure the housing is safe, the water's been turned on, a sample's been taken and it's good, sleeping quarters and cooking facilities because this is their house. They've got to have a place to cook, a place to sit down and eat. Ours are all very good. You can see our sanitarian in the bottom picture there testing the smoke detector because we also look at fire safety. So once we inspect, we send that report to the Department of Labor, and then, and only then, will they direct the migrant worker to enter the country and proceed to the farm. Every year but the pandemic, we have a county fair up in Sandy Creek. And if you wonder what we're doing at this event, it's of course the fair food, but you've got lots of animals producing lots of manure, and then there's people touching the animals, and then there's the fairway full of wonderful finger food and fair food. So you can see the connection where there can be disease transmitted to people, and we emphasize the placement of portable hand wash stations, especially near the petting zoos and the barns for the animals. And then we put up signage that says, remember to wash your hands. There's a dorm and a campground up there also, so it's not just, food concessions at a fairground. I can see my age is kicking in, guys, so I'm tremoring. I apologize. So we have a lot of mobile parks in our county, and they range in size from 5, smallest, all the way up to ones with over 125. We're looking at the water supply. This is where people are living. Safe water, proper working sewage facilities, that the lots are prepared and have anchor systems that have been attached, and that refuse is either picked up at the curbside or they have a central collection center like a dumpster where they can take it.
Excuse me.
Mhm.
Go back.
Oh, you want me to talk about pictures?
Yeah, let's talk about that anchoring systems. A lot of people don't have them, but I happen to have in my district 5 of those damn things. And they're old. I mean, they were built when I was a kid. And some of the trailers in there, number one, they're a rat infested in some of these places because they're abandoned. within the park.
Right.
Do we really, because I know a lot of these places are not anchored, I can tell you right now, they're not anchored, because I know what that's all about, because I had bought and sold a couple of them on pieces of private pieces of property, had to anchor them down.
Mhm.
Is there really an inspection sheet that's kept by somebody that somebody is going up underneath there making sure they're anchored?
I'll tell you why we don't make that part of our inspection. Once the skirting comes up, we can't remove that skirting, and we have the park rules and regs, and we talk to the owners. If they're telling us there is anchoring under there, that's what we have to accept. But we can also refer to the code enforcement officer to go in with us, and then have, we like team tag them if the anchoring systems aren't there. But yes, that does happen, and when the skirting is falling down, that's our opportunity to look under there, and we do see some. We don't see everything.
No, you're getting good cooperation from the town's code enforcement, because most of them are part-time. I know Hastings is full-time. There might be a couple others, I'm just not aware. I'm sure like city, obviously they're metropolitan, well, not metropolitan, but Fulton and Oswego
Mhm.
would have a department. But a lot of your small towns, you're lucky to get these
Right.
guys and gals to work a couple days a week. I mean, it's just the way it's budgeted, that's all.
I know. And they have many towns under one
That
person.
is correct.
So we do encourage, and that's part of what I'm having the staff do, is develop a relationship with them. And if they can go after hours, my staff can adjust their hours and go out. But we're trying to get that communication and working together, the camaraderie going. But we do get a lot of reports of trash from our codes guys. And when the dilapidated ones, we contact the code, tell them that it's been abandoned, it's falling down, the windows are broken, the doors are ajar, animals and children are going in there. Also, we have seen where drug use happens in the abandoned ones. Yeah. So if you're aware of one, we do have a complaint program. You can call us and direct us to the right park, maybe a general vicinity in the park, and we can do something about it, get the ball rolling.
Thank you.
Mhm. This is good because we have codes, sanitary codes for facilities that we permit. But what about the private residents, private people, and businesses we don't permit? Well, we have a public health nuisance program that uses Part 8 of the umbrella of the public health law in the state. And our complaints are pretty intense. We get 60 to 80 a year, even during COVID. We managed to get 67 each year. And they fall into three main categories: septic outbreaks, accumulation of household garbage outside, and rodent infestations, usually because of the trash that's accumulated. And we have a two-person team that goes out and works with the people. They'll do dye testing if we want to confirm it's a failing septic system before we speak to a private individual whose septic is running down the road, getting in the culverts and ditches, or even on the property of their neighbors. So we do a dye test with fluorescent dye. You can see we have the beautiful green up top, and we've got the red, which shows up really good when they're very close to a body of water. So if we find it, my team works with them. We give them a timetable of compliance to have somebody check out their septic system or to remove that trash. If they don't move along, if they are ignoring us, then again, we have the county attorney who will get involved, and hopefully just a letter from them is enough to get them going. I always pause on this one. Oh, I'm sorry, Craig.
No, it's okay, it was on the last one. The garbage, rats, and all that, that's more or less rural. Right? Because I know the city of Fulton, you could not come into the city of Fulton. with, because we have our own
You
code.
do your own septic,
Yeah,
your
our own.
municipal stuff.
Okay.
Yes, yes.
I was hoping you'd come in, but, yeah. Okay, thank you.
So I like to pause on public health engineering. We do have a public health engineer who's been with us 16 years. He has a master's in master's in environmental engineering, and he's a professionally licensed engineer. Gold standard. Any county would kill to have someone with that qualification and the dedication to getting work done that ours has. But it's too much work for one person. So we are going to skip this argument because you probably have heard it before, but we were approved to get an assistant engineer. In 3 months, we have not had one applicant. They're very hard to get. And this is not even a licensed engineer. This is just a graduate with a bachelor's in engineering. I'm not sure what's going to happen, but hopefully we get someone.
I'm gonna be a pain in your rear. Doc, didn't we, in the reorganization, didn't we put in money for that?
Yes,
Yes.
yes. The issue is really pay. And public health all work at the government, the public sector. And the payment is low and it's hard to get people. And if I can say 2 more words, it's really, now I start to worry about our nursing team. And nursing, yes, you can see, yes, burnout, and our nurse recently, yes, I think I got to resign. So it's a real thing. But to go back to environmental engineer, I was this specific engineer, and probably Judy shy to share with you, and I brought a photocopy here. This is a thank you note from Pulaski's village board, and because this engineer worked with them most recently, and he worked with them till 2 o'clock in the early morning. He helped them find the issue, and he left. So really, this engineer is almost like 24 hours on call, but he pays much lower than city of Oswego engineer.
Is that Bill?
Yeah.
Yes.
Yeah.
That was the Pulaski water main break recently.
Yeah. And they don't know how to do it, and he went there and he found the issue. Yeah.
I just wanted to pause on that. Just in 2021 alone, he approved 2 municipal water treatment plant improvement plans. We brought this to show you, this is one water treatment plant plan, and it represents approximately 2 full man-hours. It's spread out over time. But to review the plans, make the comments, send the letters, do the site visits during construction, and to attend the wherever these are located, attend the town meetings and so forth. So I just want to show you that this is overwhelming, and his whole office is filled like this. But he keeps on top of it. So hopefully we can get another assistant or an assistant. But if we can't, it's pretty obvious that for the amount allotted, you're not going to get an engineering student to start at that low pay. But who knows? Miracles happen. So then, anybody?
You have a question? Yeah, how much do we allocate for this guy or gal?
I think 46 or 47,000.
That's part-time?
No, full time.
Full-time?
Full time. Yeah. It's not much. I mean,
No, not with the degree you need.
no, and the private sector is paying
No, I get it.
100, and City of Oswego, I believe, was paying over 100. So, and that's for an engineer probably like Bill that has the master's and the license. So, I don't know. The beauty of this is if we can get someone, they can work under our public health engineer, over a course of, I believe it's between 2 and 3 years, can actually earn the professional license, which would put them in good stance to move up to the full public health engineer when he retires. He's not real close, but he's getting there. So the health department has a childhood lead poisoning prevention program, and it's made up of two components. The nursing component, who looks at the child, their medical progress and development, and reminds them to get their blood tested. And then the environmental health component. We are the ones that go into the child's house or wherever they spend a significant amount of time, and we look for where did the exposure come from? Where did the lead come from that caused their blood level to be so high? We do this with an XRF device, which is a gamma ray emitting device that can determine how much and if lead is present in lead-based paint. We take dust samples to see if deteriorating paint is laying down the dusty chalk on floors and surfaces. And we also do a lot of education to the parents. So if we find it, and a notice of demand is issued for elimination or remediation, and very rarely, but it has occurred, if we can't get a property owner or landlord, usually the people who own the house themselves and their children live there, they want to take care of it right away. But if we can't get the landlord to move forward, we turn to the county attorney for assistance. And here, this is our case referrals. You can see a big jump from 2018 and 19 and 20, and that's because the law changed, because there's a code for lead poisoning too, because there's a code for everything, and it changed the definition of being a poisoned child is if the blood lead level is 5 micrograms per deciliter, very small. It used to be 15 micrograms per deciliter. So it's harder to find the source of exposure at these low levels, and it's also, there's a whole lot more cases. We increased our caseload by an 8-fold amount, and it's taking up a lot of the staff time. But like I said, it's hard to find the exposure, and it's hard to get the child to drop. Once you're at 5, it's fairly low, but no level is a safe level. But they chose 5. To go from 5 to a 4 takes quite a bit of time, but to go from the old 15 to a 14, that happened more quickly. So what we're ending up with, there were 22 new referrals in 2021, but 36 cases were carried over from the previous 2 years because we can't close the case till the child's level goes down, and the level has to go down. And then the other one is if the house has had remediation work done. I know I'm taking a really long time. Okay, mass gathering.
This is our favorite.
I know. This is Super Dirt Week, and it falls into the mass gathering code because 5,000 people or more are going to be going into one contained area that has gates. And it continues through the night. It lasts for 24 hours or more. Harborfest is not one because there's no main entrance gates. There's Harborfest all over the city, and you can enter from any street or sidewalk. So that doesn't fall in here. Our goal is to prevent or minimize risk of injury and to maximize the safety for everybody. But we could not do this without the collaboration with other agencies. We are the lead agency because we issue the permit to operate. But as you can see, our wheelhouse is not EMS, medical provision, fire prevention like the fire departments do and law enforcement. So what happens is those agencies work with the promoter, give him advice, help him develop his plan. Every year a plan must be submitted before they get the permit. And then when they give the nod, and it's in the code that they must sign off, when they give the nod, this is a great plan, we accept it, and everything we look at is satisfactory, Genshin will issue the permit to the promoter. We do it in conjunction with New York State, and that's only the EMS component. This has become our new thorn in our side. The old Clean Indoor Air Act, we no longer go to work and have our neighbors smoking or going into a bar or restaurant smoking. Clean Indoor Air Act has worked very well and it's settled down. But the Adolescent Tobacco Use Prevention Act is causing some problems. We're trying to prevent the sale of tobacco products to minors. And the newest problem is vape shops. They're popping up everywhere, and we don't know they're popping up. Sometimes they're not even licensed by the Department of Tax and Finance for tobacco sales. So there's been a new amendment, and we have not got our policy in place yet for this. We did the old one, where kids went in to buy cigarettes. Once we got to these vape products, it's much more difficult, and they're not in the usual locations. A lot of them go right next to schools, middle schools, and high schools, and the principals are quite upset. So we have 93 places that sell tobacco in our county, and since January, 3 new vape shops popped up. So they're popping up fast. And the issue is really, how safe is it for our staff to go into these vape shops? Because they have tens of thousands of product, and the new amendment to the law says that each product can be fined up to $100 per package. And we're talking like 7,000, 5,000 products in the store. And I don't know, we're not law enforcement. And what happened was enforcement for selling tobacco products to minors shifted from the criminal justice system to environmental health with the ATUPA laws. That's what we're dealing with. You'll hear more. Yes.
So, you're not being informed. Well, should the planning departments for said cities or towns or villages usually, okay, should they be contacting you guys to inform that they have plans for a vape shop opening or a smoke shop, whatever they want to call it, okay, in the city or in the village? Is there a plan for that to happen, or is there a process for that to happen, or is it you guys only get to find out if something happens or something?
That would be a wonderful thing. I can't tell other agencies what to put in place, but we try to have good relationships with the towns and the cities. And I know, I'm taking it way back, when Grace Talents was the code enforcement for City of Fulton, that was my area when I was a field person. And we called each other, texted each other all the time. Do you know about this pizza shop? Do you know about this tattoo shop? Do you know, what do you know? And that's what we're encouraging happens. But yes, also the city clerk in Fulton used to contact us if he got an application. But as regimes change and as people change, it goes by the wayside.
The reason I asked is because they're starting to pop up in the city of Fulton.
Yes, they are.
Quite
It's
a bit. It's a pet peeve of mine that I'm getting a lot of flack about it. I don't mind, and I don't mind business. But the city of Oswego, I checked with some people in the city of Oswego, and they have their vape shops, and which if there's going to be a licensed marijuana sale, it will be in the outlying strip malls as per se, okay? Instead of in the city proper. But I'm looking for another, you're talking about they should be contacting, there should be a good relationship between the county health and nurse prevent and the city, okay?
Yeah.
The reason I'm asking that, I plan on going to a common council meeting tonight, we're getting elected, and there's a few things I gotta bring up.
That'd be
Okay,
fantastic.
Thank you.
Question for you.
Yeah.
Is there a list of what ones are out there that you know of, so that if Frank's going to the city council meeting, he can say, hey, we know of these. There are
Yes,
these-
we can download that
Is that
from
something the
Department
public
of
can
Tax
get?
and Finance, and those are the ones we're aware of.
I mean, maybe that can be passed on to the city so they can do their own double checks too.
That's wonderful idea,
Good idea.
yeah.
There you go, Frank.
So I also want to say that this is flavored nicotine products. Those are illegal to sell to anybody, adult or child. The way they're getting around it is they sell canisters of flavor and canisters of nicotine juice. And then they are combined later, even though they put up a sign saying, these are not intended to be combined together. But we know that's why people do that. They're also selling the combined pens. We're going to start doing our compliance checks with the youth this month and next month. Difficulty is the age was raised to 21. We can't take our 15 and 16-year-olds anymore. The state's recommending we get a 19 or 20-year-old that looks closer to the cutoff age. But we'd like to, so we're going to be starting that. Oh, rabies. We have rabies in our area. It's endemic, and we have a program to prevent rabies in humans. It's two-pronged. The first thing we do is exposure. And what happens is our county started our rabies program over 30 years ago, and we are held up as a model for other counties. So we have a 24/7 line. Any mammal biting, scratching, we get people calling about spiders and chickens too. But, we keep it at rabies. And our team is experts in the interview process to determine if yes or no an actual rabies exposure happened and the virus could have been transmitted. And then we have another tool which is testing of the animal, if the animal is available, sending it off to Oswego and getting an absolute confirmatory yes rabies, no rabies. This last year we had 30 exposures, definite exposures for humans. We get a lot for pets, domestic pets too, and we have a process for that. But for humans, we identified 30 cases where post-exposure treatment would be recommended. As you can see, the actual exposures that happen compared to the actual post-exposure treatment shots that were given is a difference of 4, and that's because there's multiple victims for just one animal sometimes. If we can't find the animal, and we aren't sure, and we know that that bite could cause rabies, we're going to give them the shots. We err on the side of caution. Vectors and arbovirus. Arbovirus is just a fancy name for viruses carried by insects, and the insects that we are concerned with are mosquitoes, and the two diseases are Triple E and West Nile virus. So our division's main focus is education. We teach people through public announcements and on our county website and interviews on TV. Dress so that you prevent mosquito bites. Wear a repellent and try to avoid going outside at dawn and dusk when they are most active outside. Then in addition to that, we do surveillance. We collect specimens of mosquitoes, and we have a bug lab, as we affectionately call it, out in West Monroe, where a state entomologist is there to work with us, train summer staff to identify mosquitoes. I don't know why I didn't use this, I've got it. These are all individual mosquitoes, on this table, and it's one sample, so they sort them. They dump them on the table, and they're putting them in the Petri dishes according to what species they are. And then we send them off, well, they drive them over to Albany every Friday, and they do their test to find if a virus is present. If a virus is present in these samples that we send over, then the state contacts us, we work with them, and Judge Cheng moves for he always has to help me, a declaration of an imminent threat to public health. What that allows us to do is do control measures against these specific mosquitoes. The one that carries West Tripoli lives in the roots of swamp trees, so that's where we concentrate collections, and that's where we, if we spray, the adult larvicide is administered. Last year, we did 2 sprayings, one in the Toad Harbor in Constantia, West Monroe area, and the other one was in the Hastings, Mexico, Palermo area, which was another area of collection. We're not there to knock down the population of mosquitoes, meaning all the mosquitoes and all the species. We're here to monitor for the specific ones that carry a disease, especially Tripoli, which can be deadly. And
There are over 30 different kinds of mosquito, and we focus on 3-4 kinds of mosquitoes. They carry Triple E and possibly West Nile virus. That's why sorting is every day it's a pile, and we have 3-4 students that we call summer help and help out.
Are bat houses helpful in areas that are high in mosquito populations?
Because bats are vectors for rabies,
Right.
we don't encourage people to have bat houses. A lot of our children's camps want to have bat houses as an educational tool, and we tell them probably not a good idea to track the bats. Yeah. But I know a lot of private people have them.
Right.
We have 2 landfills in the county. A closed one, that's a listed federal Superfund site, and that's the Oswego Valley Silk Road landfill, and we also have Bristol Hill, which is the open one, and that is licensed to operate by the DEC. My team is responsible for doing groundwater sampling and leachate sampling, the product that goes through the ground. Starting to get short of that. Give me a second.
If I can add here, and really our team doing a great job, and every 5 years federal DEC agency came to effect, and every I can get 2015, and the county cost the county probably over $100,000 to prepare it and get the things ready. So the next I saw was 2020, COVID hit us and they postponed it. So I think late last year, and the DEC sent us a letter say, because every quarter we timely send this water results to them, and they just want to look at the environment, if your fence is good or not, and next inspection will be 2026. So this really, the team did a great job.
And there are ongoing O&M costs that the EPA also bills the county for pursuant to the consent decree. The county was involved with US EPA, DEC, and the PRPs, potentially responsible parties, larger producers of waste to that landfill, which are manufacturers that existed at the time the landfill was open. And pursuant to the consent decree, we're responsible for paying portions of the O&M costs, and that was just paid out of the capital project about a month and a half ago to EPA Region 2. The natural attenuation of the VOCs, it looks like it's on a good track. So we'll see how long this consent decree remains in place. At some point, natural conclusion would be we don't have to do this anymore. But for the time being, that's not the case.
Last slide, just clumping things together where we are supporting other divisions in the health department or other agencies. The radiation protection program, we have 3 nuclear plants. So what my staff do is they go out every week and take air samples, and they go out every month and take a lake water sample and send that to Albany for evaluation and analysis. Hazmat spills were part of the response team. We are notified by 911 whenever there's a spill from level 4 on up. And just Sunday, I got the call that there was a level 3 out in, where was that? Okay.
Yeah, I don't
It
remember.
was on 176.
Is it truck leaking gas?
Yes. Yeah, so. We really only get actively involved, other than being alerted to them, when a well source, a water source or a well could potentially be contaminated. So we go out and investigate. And then the last is the county emergency preparedness planning and response. Our people drill for pods, which are points of distribution, where in the event of a mass illness or disease, we have people who are prepared to receive and distribute products. Came in real handy when we had the COVID pandemic. Our staff was able to help with the vaccination clinics, testing pods, delivering supplies throughout the county. Very last one is who are we? We're pretty wacky people that go to work and walk through failing septic systems and arbitrate between mobile home park owners and tenants and have to investigate drownings and sexual abuse at camps. Well, just to get in the door, you have to have a degree in science, the core sciences, because of the complexity of our programs, with the exception of the public health engineer that has a master's in engineering, and our epidemiologist we got who has a master's in public health, especially concentrating on epidemiology and biostatistics. And then once you get in the door, your training really just begins. And within 2 years, everyone but our clerical staff has to complete the SUNY at Albany School of Public Health Basic Environmental Health course. It's very extensive. It goes from environmental health law to all the programs we do, ethics. And like I said, this is an introduction, and if you would like to know more about what we do and how we train our people, I'd be happy to let you know. And I'm sorry it took so long.
No, you didn't take too long.
Thank you.
Just don't let him talk. It just popped into my mind because listening to everything you had, it's very informative, and I appreciate what you do. The city of Fulton runs a campground, North Bay Campground.
Yes,
That falls under your jurisdiction,
Yes.
correct? And you do keep a close eye on that and do the study.
yeah, we have to do, we have to permit them in the first place, so they can't look until they get the permit. And then we do at least one in-season when they're open inspection, and they look at everything under the code.
Good. Thank you very much.
Quick question. Did I misunderstand you? You say you, not you personally, the department investigates sexual, you said something about sexual abuse at campgrounds or whatever?
Yes, yes, yes. We've done this, we bring in law enforcement as well.
Okay, that's what I want to know.
And if it's
It's fine.
pretty egregious, then the state will come in as well. Usually it's camper on camper, yeah, or it's a counselor on a camper, and very rarely is it something that is absolutely horrible. It's a horrible experience, but there has not been any actual X.
Pump.
Right. Yes.
One quick question. Manufacturing, if they have their own in-plant treatment system or a byproduct of what they may produce, do you inspect those systems?
So which,
Like up at the old Armstrong plant, there's a sewage treatment plant down a little bit from there, which they would use for their own waste treatment of their product.
no, what we do for factories and things, if there's a private water supply, we go into that. Other than that, maybe,
Okay.
I don't know who would do that. If it's a discharge, probably DEC.
The point
right?
source discharge would be a permit from the DEC and or EPA, depending if they're discharging a river. Yeah.
Okay.
So, for the new kids on the block, one of the differences with Oswego County, the size that we are, that makes us a full-service health department is environmental. And that also creates another revenue stream for the county, because we are a full-service health department, whereas other counties our size are not. Okay, who's next?
Next, you can prepare your slides. And the next is need your approval in your package. This nursing division professional advisory counselor, and because this is nursing operation, and by state requirement, and quarterly we need to have a quarterly meeting, and it included all our nurse-related operation, and you can see hospice program, preventive program, and also joint program like lead program, and it's all included there. And this advisory committee include more than 10, I think, professionals in the from local area, and they generated this report, and if you approval, and yes, next step we will share with Board of Health and file in our department. This is, if you have any questions.
I'll make a motion to approve.
Second?
Yeah, I thought you said so.
Yeah, you made a motion to approve.
And then you second.
No, it's a-
Oh, a second, I'll second, yeah.
Second.
All right, okay. Yeah, you said so.
All in favor?
Aye.
Opposed? Motion carries.
Okay, thank you. So now it's your turn.
Hello everybody, for those who don't know me and haven't had the pleasure of meeting yet, my name is Nate DeGear. I am the new EMS coordinator down at the Emergency Management Office. I'd like to thank the committee for having me today, as well as Health Department for inviting me here. I'm here to speak about the mental health increases we're seeing countywide through our 911 emergency response system. So the data we're looking at, I collected from Kevin Cooley and his staff over the 911 center, and this data just pertains something called EDP, emotionally disturbed person. So these are just mental health related 911 calls. Alright, so looking at the data from 2019 to 2022 through March 10th, March 10th through this year. You see in 2019 we had a total of 441 of those calls, 467 in 2020, and then between 2020 and 2021 you saw a massive leap up to 664 total calls. Through this year so far, like I said, through March 10th, we've seen 120. So how that boils down is about 1 per day in 2019, and now we're upwards of about 2 per day so far. It does look like we're on a slight decrease from last year, but we're going to dive into that in a little bit. Just give a chance to look over the numbers a little bit. And if anyone has any questions, please feel free to just go ahead and ask.
They will.
I'm sure.
They have that freedom in this committee.
So just to put that as a little bit more of a visual instead of just numbers on a chart. You can see that between the 2020 and 2021 year, there was a massive increase, and we're slightly down this year. So just to put this in a different light, with percentages, 2019 and 2020 we saw an increase of about 6%. 2020 and 2021 there was an increase of 42%. So the call volume of mental health related 911 calls increased 42% in 1 year. When you add in the slight decrease we're experiencing so far this year, it's a net increase over the 3 and a quarter years of 43%. So quite the increase. Let's just break down that decrease a little bit. It is encouraging that this pace looks like it's going to slow down, but we have reasons to believe that this is not going to end up being the result when the year is said and done. One of the reasons is SAD, seasonal affective disorder. This disorder flares up later in the year. We're starting to see the warmer months. We're starting to get through the winter time, so it's going to be later in the fall and in the winter later on in this year where mental health cases are going to increase, which can increase that percentage, as well as economic struggles. We're in a climate right now, there's a lot of uncertainty on the global stage, and we're seeing economic struggles, and there's reasons to believe that might worsen or at least stay the same. So income decline, debt increase, and all unemployment, income decline, and debt all increase mental health related issues. So for those two reasons, we believe that down 4.67% is not going to stay consistent. It's going to continue to increase from last year. So how does this affect our EMS and police availability? Many of these calls, they require both EMS and law personnel to respond. This has drastically increased the demand for first responders, and we're in an environment where there's not many available. So it's kind of a double-edged sword there. And this is all on top of that 43% increase is all on top of what they're normally seeing on a day-to-day basis. That's just one category that's increased immensely on top of their normal call volume. As far as hospital availability, it's been very difficult for emergency rooms to find care for the mental health patients that get transferred to their facilities. Emergency departments aren't typically where mental health related patients get the specialized care that they need. Emergency departments are largely there to treat trauma, and medical related issues, not mental health related issues. Additionally, many of these patients require 24/7 observation, so ER staff that normally would be performing other duties now have to sit and observe with this patient.
So I have a question.
Sure.
Isn't that the whole purpose of the new facility that they built over near the port?
Yeah, so
which was much larger, much more capacity. So that's not capable of taking some of this pressure away?
We're going to talk about that on the next slide, which you'll see, but that facility already has a 6-month wait time for initial appointment.
So it's not big enough before it opened.
And Hutchins.
And Hutchins is in Syracuse. Upstate's opening that up. It's going to be a 25-bed child mental health facility, and I'm guessing Upstate already has 25 patients ready to plug right in. So like I said, Oswego Health, you can see the last bullet about that new facility, already a 6-month wait for your initial appointment. In early March, 5 of the 17 beds in their ER were utilized by mental health patients with nowhere to go. That's a third of their ER. That no longer has room for the regular patients that they see every day. Additionally, Oswego Health has dedicated 2 full-time staff members just to call mental health facilities around the state and around the area, just seeing if they have room to take their patients. One of those facilities is Four Winds, Saratoga, all the way out and towards Albany, and Capital District Psychiatric Center in Albany is facilitating that as well. So there's a massive need and there's no space for these people to go. As recently as last week, Oswego Health had a child with mental health issues that spent 13 days in the ER waiting to go somewhere. I don't know if they're still there or not. Last I heard they were still there and it was 13 days. So again, those are resources being dedicated to one patient simply because they have nowhere to go to get the care that they need. This also impacts our ambulance availability, as I touched on before. This takes away our resources from normal call volume. When the emergency rooms are at their max capacity, they go on something called DOH diversion. This is essentially the New York State Department of Health stamp of approval saying that it's unsafe for the hospital ER to take any more patients. So when Oswego House ER is on diversion, it forces all of our resources to travel further to Syracuse, when Oswego and all the Syracuse hospitals are on DOH diversion. Sometimes they have to travel as far as Jefferson and United County areas. And again, that just takes our ambulances out of our communities. And then even when they clear the hospitals, they've got the long drive back. So it has quite an impact on our resources and our patients here that need help when they call 911. So just to wrap stuff up, this data only provides the mental health related costs. It does not include the other data such as drug overdoses and domestic violence, amongst several other topics that could be closely roped into this. That could also cause a higher percentage. So I am interested in diving into that data at a later time just to see how it correlates. Unfortunately, I'm not here to give you a specific solution. There is no solution. It's my hope that the numbers and the data just helps you all wrap your head around the crisis that we're seeing. And this mental health search should be thought of as a COVID-19 recovery process. COVID-19 is unlike any other disaster. There's no physical damage. There's no buildings torn down. There's no flooding. The recovery process is the same. There's nothing to rebuild except for our mental health of our citizens. Our office is exploring different avenues to provide first responders and additional mental health resources and trainings. This includes trainings on how to recognize their own mental health struggles on the day-to-day calls, as well as trainings on how to interact with patients that are experiencing mental health crises. So I'm hopeful that trainings like that can be brought to our county very shortly in the near future. Does anyone have any questions?
Yeah.
Sure.
All I know is what I read, and of course, the media doesn't tell 100% of the truth sometimes. But suicide rates are up across the country.
Mm-hmm. Yeah.
And they're skyrocketing.
Mm-hmm.
They haven't leveled off. It's going very quickly in our teenage group of people. A lot is due to bullying, to economic disparity and things of this nature. Now, you said something about training there in your last slide. If you have any, go back. And I'm all for that. I think it's great. I really do.
If you want
this
to
is
go
what
back.
we need to do.
No.
However, and this is something we have to look at as a legislature, or specifically this community, or committee, is the more we ask of people, the more training we need to have from people. It's going to probably cost a little money.
So a lot of the trainings we're looking at are provided free by
No,
federal
but I mean
agencies.
to get the people to do it.
Sure.
I mean, you get somebody that's an EMS person like that, and you start dealing with mental health issues, that's not a nice place to be.
No. So there was a free training provided in Madison County for responders. Me living out that way, I was going to attend it. Got canceled due to lack of participation.
I'm aware of another training that the same thing happened.
Yeah.
Go ahead.
So on behalf of EMS, I did submit an ARPA proposal, and part of that proposal was the suggestion of having a social worker or somebody of capable certification, talent, etc., to be available for first responders throughout our county to be able to address mental health needs. There's a separate category under ARPA for mental health. There's money that's been put aside for that, so I don't think it's anything that this body is going to have to look at or entertain. But we do have some ideas. There is a program that we're looking at called Code Lavender that is a group of champions that, and it doesn't matter whether you're fire rescue, fire, EMS, hospital, we'd like to look across agencies to have a group of champions. And one of the big issues that we're seeing is we always say, hey, if you had a bad call, let us know, right? And there's tons of suicide hotlines and stuff like that, but somebody has to make the call. They have to make the reach out, and that's a barrier for some people. So with the Code Lavender program, there's specific instances. If there's a fatality, if there's an infant CPR, etc., there's automatic reach outs. So So you're not left to make that reach out yourself. So if you have X, Y, or Z call, a Code Lavender champion is going to reach out to you. I am going to check in with you, and that's going to become the norm. We're going to try and flip the culture so that reaching out and checking on you is a normal thing. So I know we kind of got off onto like the mental health, or I did at least, of the first responders, but that is a significant concern, and I'm concerned about Jin Chang's staff. You know, those of us who have been frontline for the last couple years, mentally, physically exhausted. Before Nate got here, I was on the edge. I flat out given everything that I could to this county and to our constituents, and so yes, I agree, it is going to take some money. Unfortunately, Nate was approved under ARPA funding, but I think what he can bring to the table in addressing this mental health crisis and offering some things here is going to be huge.
Well, you know, you mentioned these new facilities and beds that we're building, and we are, because it comes out of our tax dollars, which is money well spent. I misunderstand it. But it's already been said that that facility they're building in Syracuse down by the hospitals down there in Adams Street, you're months out already. You're already months out. And if you have a person that calls 911 and's got an issue with mental health like that, a day can be eternity.
Sure.
Yeah.
And then we got another statistic to deal with.
Absolutely. And this is the next wave coming. And we are, as a community, and we're not alone in this.
Oh, no,
But
it's a
it's the
countrywide
next wave
problem.
coming, and we're grossly underprepared to face what's coming.
And that's another unique thing about what COVID was, is all other disasters impact a community, maybe a couple communities. COVID is every community. So, and that's why the recovery process is just as challenging as what the response phase was. It's because it's not just a community affected, maybe with mental health. After the house has been torn down by a tornado or flooded by, it's mental health, everybody who's lived through the past, 2 or 3 years. So it's a lot. There's not enough resources, unfortunately.
The bearer of great news today.
Yeah.
No, it's facts are facts.
Well, and the data shows you, right? So, like, that's why you go to the data and you can see the 43% overall increase. So, when we were talking about this at the health department COVID collaboration meeting, Jin Chang asked if we would come and share some of that information with you guys so that you had a better idea of the scope of what we're facing as a community.
And that's fine, you share it, and that's great. But you can't stop sharing it. You have to keep coming back and coming back, because there's some people that are a little bit slow in learning, put it that way.
Not me.
And you gotta bring it, keep it. Jim, you and I have been around a long time, you know what I'm saying exactly.
Well, and I think you guys are going to see it in a lot of different areas. Sarah Sunday is going to be able to bring what's on the table for helping mental health of senior citizens. Nate's going to come back to public safety and he's going to say, this is what we're looking at doing for first responders. So you guys, I think, are going to see it from different avenues, but you're the big picture people.
You just keep coming back.
I do think it begs the question, though, it's more of a rhetorical question in some respects, but I mean, what do we do on a county level? I mean, in terms of county government, when this is, in my eyes, a much bigger issue than just a simple matter of policy, procedure, and even throwing money at it from a county perspective, which I don't even know what money we would throw at it from the proverbial sort of, where would you even throw money at it sort of thing, right? And so I think it's a very complex issue, there's no question about it, but.
Well, I got a couple ideas.
Sure, put them out there.
So, I went on behalf of the EMS community with that ARPA proposal.
Sure.
And I understand that there is a mental health component of ARPA funding.
Yep.
But making those connections and helping that process, that's a bigger scope than me. So helping make those connections, if this county can't look at funding something like that, but maybe you as a county want to look at what programs are available for your individual employees. You know what I mean? If you had somebody on staff here that I was able to make an appointment for, you know what I mean?
Sure.
Do you give people 1 hour a month if they want to go and meet with that individual? You know what I mean? Like, so you get cancer screening time off or whatever. So think about so many of your departments that see not great things. Maybe help them process some of that. I would suggest, we just got information from Mary Ellen about a training. So this particular 1 day is free, but then there's a 5-day train the trainer. So I would say when a proposal comes across your desk to pay travel and pay for somebody to go, 2 or 3 individuals, fund it. And then have them come back and apply whatever they learn in the county. So those would be 2 of my suggestions.
Those are good ones.
Thanks.
Gives us something to wrap our heads around.
I'd be happy to come back and give updated data as it comes about. I asked everyone for the data, and they got back to me with it all in like 3 minutes, so it's pretty easily pulled. So.
Oh, I have a third one. We need seed money for Code Lavender. We'll talk about that later. We'll bring it to public safety just to get the.
Yeah.
We need training first, right? If you're going to have champions, you need training first. So we got to look at the training piece first, and then getting the program up and running. But you know,
I'd be happy to answer anything else.
Just keep coming back.
Thank you very much. I have only 5 slides. Give me 5 minutes. Give you a couple of days. And thank you very much for this rabies clinic schedule. And I think, yes, we sent out before the end of middle of last month. And our first clinic was successful. And we,
How many?
216 or something, yeah.
Nice.
Yeah.
that's awesome.
All right.
I would encourage you, if you've never been to one of those, to go. At least go to once in your career as a legislative representative to watch that operation.
And
Or take your pet.
every time I start to update you COVID-19 with boring draft of tiny bar line, and found it from website. I found this, and I think this you can see a quicker update here. And this is 2020. This is 2021. This is 2022. And you can see our first case started later part of March 2020, and you can see our peak period at the beginning of 2021, and then it's 13, 12 weeks, long time drag, and this is what exactly Renee said, and all our staff is heavy toll on our staff, physical, mental health. So this is the overview for these 2 years, and you can see. And I didn't put the April here yet, and color is getting darker and darker. Okay. Yes, this is what you're familiar with, and I updated it till yesterday, and you can see the cases increase here. And this very much is because a new variant, Omicron BA2, started. And this is a nationwide. This I borrow from CDC or state slides, and you can see in this country, northeast region, and all these Omicron 2 dominant, and about a dozen states dominated by Omicron BA2, and they see increased cases. But the total cases country-wise is going down. But we are one of the states, and it's going up. And central New York region is the highest in the whole state. And we closely, because universal case tracking and contact tracing is stopped, but we keep it monitor congregated settings. School is one of our major settings, and you can see we monitor, and this daily case number, and not a single day over 20. This day probably just 20. We worry about it. We monitor for a long time because I think end of February, school have a 1 week vacation, and we monitored it because previous year experience was, yes, came up a lot, but this year, fortunately, no.
You know, we coming up.
Yeah, I'm gonna say next week.
Well, there's some on vacation this week.
And we continue promote vaccination, and but honestly, as I last month I reported to you, says this was our February, and at that time I said March will be less clinic and less people, and you can see here we vaccinated about 500, and here we vaccinated about 100. This is the reality with public health is fighting.
So, do you have the vaccine, and are you setting up clinics for us old farts?
We have vaccine, and we encourage people to go to local, and but still, yes, like my friend here, and he loves I want your nurse to give me shots. So you're always welcome, and we have shots, and we have schedule, and now we every Tuesday afternoon is by appointment and log on, and Wednesday is walk-in.
So you're ready on Wednesday, because I've had 2 or 3 phone calls just within the last few days.
Yeah.
I'm ready for my second booster.
Yeah.
When are they ready? And I don't think that's...
I think yesterday our press release included, and we are ready and we are open.
Okay.
And yes, I can confess to you, tomorrow probably will be busy, and the next week probably we don't think line will be long. But we prepare, if line long, because of our county situation, we will not allow people stay inside, and we work with deputy, and if too many people waiting in our lobby, we will say yes, stay in your car, give phone number, cellular phone number. Our deputy will call them and say, oh, it's your turn, it's your turn.
So is that on your website of days and hours?
Yeah.
Okay, then that's what I'll look forward to.
Okay.
Thank you.
Thank you. That's all my updates.
All right.
Thank
This
you.
was interesting.
Do you have any more data in terms of the age group, who's getting sick, or what age group, or?
Yesterday we reported, and I don't have here handy, and I remember if you look at the age group, and we don't have 0 to 18 hospitalization, and I think most 50% of hospitalization is 65 and above. That's why over the last couple of weeks, and every week when I send out, I always press release, I say yes, protect the vulnerable population, protect the community, and I still encourage people to get the vaccine. Because these people, yes, they vaccinated, and still they are at they will be hit quite high by chance.
So have we seen an equal number of non-vaccinated versus vaccinated getting this? Or?
If you talk about the last week, just the last week, because if go a week before, and dominated by non-vaccinated people, last week, and about 50% they are fully vaccinated or boosted, and a third is not vaccinated. So this because our county is small, and if you look at it, you can pinpoint the one county. Oh yeah, your vaccine is useless because 50% of your hospitalizations they vaccinated. You say protected, but no, you don't know. These people, they have underlying condition, and the first risk factor I said yes, it's age. The second risk factor is chronic condition. In the top is obesity and high blood pressure, lung disease. So I look at it, yes, sure, it's not the most recent data because so many things, and we, like Judy said, we have staff shortage, and I look at it, and I think I brought here, and our most vulnerable population, and they have one or more chronic disease and hit the most. The senior citizen with one or two chronic conditions, they hit the most. Even you vaccinated, yes, no, still.
Yeah, and all 3 phone calls I got are people with disabilities, they have other conditions. So
Yeah.
that's why they were anxious to find out about when it could come in.
Yeah, talk about we're still doing this homebound. We will continue our homebound, but honestly, I can say this: homebound is not our current priority because you stay at home, less chance to get it, and we need it because our nurse shortage, and I have to maintain internal 2 clinics, and also end of this month, we will have 2 regional local clinics, one in APW, the other in the other way, and we have 2 clinics in school. Up north, we know they have low vaccine rates, and we vaccinated their students, we vaccinated their staff, and also we want them open to vaccinate the community residents.
Yeah, and again, these 3 were not homebound. These 3 are the people that wanted to know when you were open, when they could come.
Yeah, welcome, call us, and we will put into waiting list, and homebound we still will serve. And I think just the last 2-3 months, and we did over 250 homebound, and our one staff, one nurse, and a day she drove over 100 miles in this county. Yeah.
You said that we're short on nurses. How many nurses do we have, and how many are we open? How many openings are there? How many nurses do you need? Where are we at with the number of nurses that we have versus what we don't have?
I needed to go back to look at it because recent in and out, and if immediately I can say in preventive we have 2 nurse line open now, and in hospice we have 1 nurse line open for more than a year, and also we have part-time nurse line open too, and this yes I next when preventive come to make a presentation, I will ask them to make a summary. Yeah. Yes.
Yeah, just to piggyback off the shortage of nurses. I remember the first year that I was here, we were offering a incentive or a bonus to get nurses.
$2,000, yes.
Right.
Yes.
So we still offer.
We still offer this
a signing
$2,000
bonus or something like that.
We still have this $2,000 bonus for nursing staff, but $2,000 inflation.
Well, I just look at as long as it's not, there's no cut, as long as there's a no cut clause in their contract. I mean, we could, or we offer it to them, and then they say, well, after they get it, they say goodbye. We say, well, we'll keep the money back here. I mean, I don't mind going up. I know, and I'll say it right now. Back when that originally came out, I was against it because we had so many people on unemployment. I said, why do we have to offer it? That we should be getting a lot of people. But now, after being informed more about what we do and how we do it, I would say yes, and if we have to offer more of a bonus, because we aren't able to keep people because they can get more in the private sector than they can here.
They can't give them.
I don't know. If we need to offer more to be able to get more, I'm in favor.
No, in state budget they have some money for health, but my worry is yes, if they just limited it to nurse, how about our environment health? They're not licensed. How to give them incentive to stay? So still no picture. It's hard for me to say, but this is my worrisome now.
All right. Anything else? The appropriate motion.
Motion adjourned.
Second. Anyone object?